Hi everybody, we are posting a Facebook taping, not a Facebook Live, because we just did one and there was some issues with connection, and then we had a sideways thing. So we are recording, we are live. We are not taking any cuts out of this, but we're going to put this one up on What's It Feel Like because we had some technical difficulties. So, you can't always depend on technology. Right. So, this is Angela Adamson.
Hello.
Angela is a licensed cognitive behavioral therapist. And for those of you that are new to What's It Feel Like, my name is Laura. I'm the creator of the platform. And What's It Feel Like has been designed just to help be a place where we can all get real about getting through life. And one thing that we have found is that a lot of people are dealing with anxiety because the response in the last week has been huge. And so we know we've hit a nerve with a lot of you because you're apparently all dealing with it. I've been dealing with it as a mom for the last 4 years. And Angela is here to help us as parents figure out how to navigate this world.
Yes.
So let's start first by talking about sort of the cycle of anxiety and how that works.
Okay.
Yeah.
So the first thing to know about anxiety and feelings in general is they don't just come out of the blue. The way we feel is directly coming from how we perceive things, the way we think about things, which is why two people can be in the exact same situation and have two totally different feelings about it. It's not the situation that has a really big impact on how we feel. So the cycle of anxiety understands that we have thoughts that impact the anxiety that we feel, and we don't want to feel that way. Increased heart rate, shakiness, stomach aches, all of that stuff just doesn't feel good. And so then we engage in behaviors to try to get rid of those feelings, which makes sense because we don't want to feel it. So those behaviors tend to come up in two ways. We avoid things. If I avoid it, I just won't have to deal with the anxiety at all, and that'll be great. Or we find safety-seeking behaviors, which are behaviors that we engage in that help us do the feared behavior, but with some safety in place. I'll go to school, but only if mom walks me in. I'll go to the sleepover, but only if you promise that you'll pick me up if I call and want to be picked up. And another safety-seeking behavior that's really, really common is reassurance seeking. So kids will ask a lot of questions about
How much longer till we get there? How long are we going to be there?
Yep.
Asking repeatedly about the day's schedule, even though you've repeated it like 4 times.
Yes. Questions that don't really need to be answered, but they just need you to answer them. And you're right, sometimes over and over. And so when these behaviors happen, they create this relief in the feelings. So it works. Your child actually feels better when they ask you, when are you going to be home? And you say, I'll be home at 7. Are you sure? Do you think you're going to be later than that? No, it'll be 7. They feel better. It works. Your child feels better when they avoid going to school because they have a presentation that day. And
their stomach hurts, and they all of a sudden have a tummy ache, which is like such a common.
Oh, so common.
So common, right?
Yeah, and kids don't always know that that is a symptom of anxiety.
But their stomach really does hurt.
It really hurts.
It does hurt. They're not making it up.
No, it's a real thing. So that relief happens, but the problem here is that relief ends up just being temporary. And so the next time the same thing comes up or something similar, the whole cycle is happening again. Because anytime you do anything that works, it gets reinforced. If avoiding makes you feel better, your brain is going to interpret that as, okay, that's a good thing, I'm going to keep doing that. Our brain doesn't always have the ability to assess, well, this is really a short-term solution and not a long-term solution. It's just like, I'm going to do it, that makes me feel better. And so whenever you're acting on thoughts that aren't totally true, then you are reinforcing it because you're taking action on something that doesn't really need to be addressed. And so we have to break this cycle, and we address breaking the cycle by intervening with thoughts and behavior, because people don't generally have direct control over their feelings. They have control over their feelings through their thoughts and their behaviors. So.
And I love your definition of anxiety. Can you give me that definition, because I think it resonates with a lot of people.
Yeah, so anxiety is two things coming together to create this perfect storm. It's when we overestimate the risk of something bad happening, and then we also underestimate our ability to cope with it. And when those two things are happening, of course you're going to be anxious.
Right.
And so that feels really bad, and then you're going to go into those modes of trying to protect yourself and and feel safe, because it triggers all of the body stuff, the emotional stuff that's so uncomfortable to feel.
And help some parents that are watching this understand when it might be time, some of the common signs you'll see with kids that have anxiety and they're not getting treated.
Yeah. So if things are going on for weeks at a time, months at a time, and not resolving themselves, it's time to seek help. I mean, kids that don't have anxiety disorders can be reassured and move through their anxieties relatively quickly. Every kid has anxiety. Every human has anxiety. But when it's getting stuck and you're not moving through it, then you really need to get help so the cycle doesn't become something that keeps getting reinforced and creates a bigger problem. So if your child is avoiding things a lot, your child is asking you a lot of questions, your child has all of these rules about how things need to be in order to be willing to do something, like I'm only going to go to school if you come with me kind of rules, and it's getting in the way of life. I mean, that's a really big component. Is it impacting functioning for your child, for you? Is the family accommodating this? Are you as the parent getting really stressed out because you never know what's going to happen with your child's willingness to do things or their behavior? If those things are happening, make an appointment with someone and just find out if it's something that needs to be addressed, because there are things that are developmentally appropriate. I mean, all kids get anxious.
All kids get nervous when they get dropped off at preschool, right? But if they're if they're in their second year of preschool and they're still hanging on to you and complaining of stomach aches and they can't socialize with other kids or move forward to the next step, that would be a sign that
exactly. So finding out those things that you as a parent can tweak in order to help reduce the anxiety, because sometimes you don't realize, like the dropping off at school example is a good one, where if your child is really upset dropping them off at school, it is so hard to walk away from a child in distress.
Oh my gosh.
That doesn't come naturally to anybody. And so most parents are going to want to comfort their child and reassure them and try to stay there until their child calms down. But what actually happens when you do that is you're following that cycle. You're acting as if their anxiety and distress is real. And so you're staying because it's real, instead of being empathic and saying, wow, this is really hard. You probably have lots of feelings in your body right now. They probably feel really icky. You're safe. I will be here for you when I pick you up from school, and I gotta go now. Kisses, love you, even if your child's crying.
And I have had to do that countless times with her, crying and upset, and I say, and then I leave the room crying. I don't let her see me cry, but I cry when I get in my car. But it's the best thing, because I always find out that a couple minutes after I left, she was fine, because she was then forced to work her way through it. I mean, I can't tell you how many times. There's been maybe one or two where she really just couldn't handle it, but every time I do it, the more I do it, the more I'm like, I know she's going to be fine. I know she's going to be fine. My heart's racing. I'm sweating. But it's so empowering for her to see that she can work through it. It's actually helping her. It sounds crazy, but it is helping her. It is really helping her. So what about the anger side of things too? Because I know a lot of people can sometimes, I don't understand why my kid is so angry, but talk about how common that component works right alongside with anxiety.
So anger can often be the secondary emotion that people use as a way to cope with feelings that feel more vulnerable, like anxiety and sadness. And when it feels too scary, or you don't even know the language to be able to say, hey, I'm feeling nervous, it can come out as anger, because it's a way for someone to get their need met, right? You start yelling at someone, and guess what? Mom or dad are probably going to react and address it, even if it's not,
even if it's a negative reaction.
So any kind of attention to emotions or behavior can help a child, even if it doesn't seem like that would make a lot of sense. So,
and I think that's one of the hardest things as a parent, to try and ignore negative behavior, which is often advice I've been given to, walk away when there have been times when it's coming after me still, the anger, and then other siblings in the house are seeing, I'm not sure why you're ignoring this, but talk about how that really does help in the end.
So there's a balance of it, because you don't want to pay attention to the behavior, but you want to send the message to your child that you're there for them and you're acknowledging their feelings, right? So offering the empathy, like, this seems really hard for you. It's okay to have these feelings. I'm here for you. When you're ready, why don't you take some time to calm down? And I can sit with you quietly if you want, but not continuing to engage in discussion about the behavior. Nobody processes information when they're upset.
Right.
So, I mean, that's just kind of the basics in brain science. Let a person calm down.
Right. Don't try to have a reason with them, because it doesn't work.
It doesn't work. Let them calm down. Allow them to have their feelings. And so you can ignore behavior in an empathic and compassionate way. And that's one thing I want to be clear, that ignoring is not supposed to be punitive. It's supposed to be almost comforting, and sometimes a child will calm down faster when you're ignoring the behavior and really just focusing on the emotion and giving your child space to calm their bodies down.
Yeah, and that's a great point, because we shared a video last week, at the end of last week, where Tony talked about having panic attacks, and sometimes he just needs to be around someone that wasn't having it, not say anything, but just see that somebody else is calm in that situation.
Yeah.
And then he says, okay, if this person isn't worried about me right now and doesn't think something's drastically wrong, then I'm going to mirror that behavior. So that really coincides almost exactly with what he was saying.
Yeah.
Can you talk about some of the trends that you're seeing and the kids that you're seeing with the perfectionism and, you know, also the cutting, two of the bigger trends you're seeing right now?
Yeah, so people come up with different ways to cope with their anxieties. And so one of the main things that I've been seeing that's just been huge lately in my office is perfectionism. I can't tell you how many teenagers come in here and are struggling with this, and I'm seeing it at younger and younger ages now too. I mean, elementary age kids are coming in with these struggles where they just never feel like anything is good enough, and it leads to really two things. It can lead to this excessive effort put into things that's unreasonable and stressful, or it can lead to really, really problematic procrastination. And so it causes so much stress for teenagers, and it really is a coping mechanism. I don't feel good enough, and so I'm anxious, and now my behavioral way to cope with this is to overachieve or just avoid.
And what about the cutting?
Yeah, so cutting is another thing that kids will experiment with, and it is an interesting thing because it follows that cycle of anxiety also. It's a harder one for people to understand because cutting doesn't seem like it would be something
right. Why would someone want to hurt? If you have anxiety about things, wouldn't you have anxiety about cutting yourself?
Right, yeah. So when somebody's having really severe emotional pain, they often feel better to inflict physical pain. Physical pain, you can feel like you're more in control of it than emotional pain. And the thing is that it actually does work to relieve some of that emotional distress. And so again, it gets reinforced within that cycle, even though it's not healthy. And will probably lead to longer term problems or bigger problems if it's not addressed. It does actually work, and so it is a problem that we're seeing more of. But I do also want to just say that cutting behaviors aren't generally linked to suicidal thoughts. Most people that are cutting aren't having, it's not a suicide attempt, and it's a way to really relieve that emotional pain.
And I've talked to a number of parents whose kids have done this, and it's very treatable.
Yeah.
Very treatable. It doesn't mean they're going to be self-harming. I mean, a number of them that they went to some therapy over a few months, and they were able to really stop that. And I think it's so interesting how control is at such the center of anxiety because people feel out of control, so they find other ways and other things to control their feeling of being out of control. It's just such an interesting thing to me.
It's all about getting rid of that feeling and those fears.
Right.
It is, and it manifests so differently in everyone too. Yeah. So you can have someone like the procrastination versus overachieving thing, where those are wildly different behaviors, but they're coming from the same exact central fear of not being good enough.
And what about social media?
Yeah.
I mean, we did not talk about this in the Facebook Live, which is maybe why it was not meant to work, because I think this is an important point, is that social media, you have almost every kid talk about that.
I do. Kids bring that up all the time. It is such a big issue for teenagers because everyone is on social media. Their friends are on it. And people post so much on social media now. And the amount that kids are comparing themselves to
No wonder
other
they want to be
kids.
perfect all the time.
Right, yeah. It causes so much anxiety. You know what people are doing. You know if you've been invited to something because you've got friends that are snapping pictures of them all hanging out and you're getting these snaps, but you haven't been invited, so now you feel even worse about yourself and you're anxious and you're depressed. I mean, it can be a really vicious thing, and I'd say the teenagers that I work with talk about that in the office all the time.
All the time.
Yeah.
Yeah, it's a fine line. I know we all as parents are trying to navigate this, this world of technology.
Right.
My kids are 9 and 11, so we haven't entered the phone world yet, thank goodness, or social media for that matter, although this whole platform is on social media, but they don't have social media accounts. And I really want to stay away from it as long as possible, just because I know it's for their age. I don't know if kids are able to process that, when to step away from social media like an adult can. We know when we're getting too stuck.
Can always,
well, yeah, and even adults can't. Right,
yeah.
exactly.
It's very addictive.
It is very addictive. You just said addiction, and I wanted to bring this next thing up, is that our last series we did on heroin, a lot of the people that we talked with that had issues with addiction stemmed from having issues with anxiety and depression that were not treated.
Yeah.
How important is it for parents out there that are listening that aren't sure what to do to take some type of step to do something for their kids' mental well-being?
And it is really critical. And
I mean, critical.
You had mentioned in your video about how if your child had the flu or diabetes or cancer, like you wouldn't just be like, oh, like hopefully it just goes away.
Even an ear infection or
Even
strep
an ear
throat,
infection.
you call right away.
You call right away.
I'm gonna get the strep test.
Yeah, but you're right. We don't think like that with mental health issues. It is really critical. Anxiety and depression are increasing, and it can really ruin lives.
Right.
But it's so treatable, and that's the thing that I really want to get across, that there are treatments that work, and if you find the right therapist and find a good fit, then this is something that you can learn to manage. It doesn't mean that you'll never feel anxious, because anxiety treatment isn't about not feeling anxious. It's about learning how to feel those feelings. Yeah, and still live your life and meet your goals. And the bonus side effect is often that the anxiety will go down,
right.
but it's not the goal. So it is so important. Reach out to someone, tell one person. It can be a really hard thing to talk about, but almost everyone that I've met with, once they start telling people, and you're a great example of this, they feel so much more empowered, so much better.
Life-changing.
Yeah, support is the number one thing. And really with talking about it, I see more and more kids coming in that are ashamed to talk about it. So I think it's really important as a parent that you model that this is something that we can talk about openly.
Yes.
It's not something that we have to pretend doesn't exist. And if you're modeling that for your child, then they won't come in and feel as ashamed.
Right.
But parents aren't the only influence on life too. So I have lots of parents that are open about it, and their kids still feel that way because you got friends and media and all that.
Right.
But it's such an important step for parents to model.
Right.
That
and I know
normal.
It's normal, and I know that we had talked about this on the Facebook Live as well. That you have a full schedule, you're on a wait list, because it is. You can't believe how busy you are right now.
Yeah, I'm so busy. I'm busier than I've ever been. I do have a wait list. These problems are increasing so much, and thanks to things like what you're doing, people are talking about it more, and more parents are reaching out to get help for this.
Yeah, I think it's kind of like a catch-22. We probably have more kids because of social media and just life now and the pressures that are feeling more anxiety, but the more we talk about it, the better chance as that number on this side is rising, hopefully the awareness is rising, so we can somehow cross in the middle and get these kids and the parents the help that they need. I got on medication when this all started because I was so overwhelmed, and it's okay. I don't have to be on medication the rest of my life, but it's helped me stay centered and focus on what I need to do for her, because it's work to parent a child that has any mental issues, but it's more work down the road if I don't do this now. And I firmly believe that. So as a parent, I encourage you out there, if you haven't taken a step, to take one small step today. Do something, talk to somebody, ask someone for help, ask someone for a referral. And is there a question you could give while we wrap this up? One question a parent should ask a therapist when they're trying to figure out if they're the right fit. Just a couple things that are good tips for them.
Sure, yeah. I mean, when you're looking for a therapist, you want to know about their approach to treatment and what the sessions are going to look like. So you could ask them about what treatment modality that they use. For anxiety disorders, cognitive behavioral therapy is really the treatment of choice for anxiety disorders, and ask them to explain to you what cognitive behavioral therapy is, and also just ask them what kinds of things they're going to be teaching you and your child, so you can get a sense that it's going to be a goal-oriented, structured approach to
and I would say make sure that you're clear on what kind of communication you can have with a therapist, because I've had some people that have had experiences where they really don't know much about what happened in the session, they weren't called, and it's a teaching process for the parent and child. So I think that's important to find somebody that really communicates.
Yeah,
I know you do that.
I do. I mean, sometimes it's a tricky thing, because the most important thing is you have to have the child trust you.
Right.
And I have some kids and teens that I work with that really don't want their parents involved in it, and so I try to navigate that as best I can. And so I do have some kids I'll work with where their parents aren't as involved at first, with one of the primary treatment goals is trying to help them reduce anxiety about talking about it with parents, and then we bring their parents in once the child is okay with that. But we don't want to wait too long for that, because parent involvement in the treatment is critical.
Right.
A child will not come and meet with me for 45 minutes once a week. And if that's all they do and their parents aren't involved, that's going to help. It's not going to help very much. So,
Right.
Yeah.
Well, we did this twice because we did a Facebook Live that was fuzzy, and do this again, and she has another session coming up. So we're going to have to wrap this up, but I just want to thank you so much for all of your insight.
Thanks for involving me.
Yeah, make one small step today, guys, to help your kid. We have more content coming out this month on anxiety. You can check out what we have so far on What's It Feel Like on YouTube. That's What's It Feel Like with a Z. We've got stuff on YouTube. We're on Instagram. And we just hope we can continue to have the conversation and keep it growing. And share, like, post, all those good things today. Thanks so much. Bye.